An inconvenient side effect of the Affordable Care Act now affecting patients here in Spokane. Not enough primary care physicians to meet the demand of the newly insured. Many of you have learned firsthand doctors in Washington becoming harder and harder to come by. According to the American Medical Association, the national average of physicians per 10,000 people is 24. But for nearly half of the counties in Washington, that number is 10 or less. KXY4's John Hendricks working for you now with a closer look at the issue and some possible solutions. He joins us now tonight live from the Sky Deck. John?
Well, Nadine, as you know, I recently just moved here to Spokane and was in need of a primary care physician. Well, a recent trip to the urgent care unit, the doctor there told me that I needed to secure a primary doctor before it became increasingly difficult. Like many of you, I was wondering why. If you've ever tried to get in to see a doctor, you know it might take some time to get an appointment.
The wait time is increasing, and it really reflects that, we have a group of primary care doctors that are getting to be a smaller group.
KIRK ROWBOTHAM is the chief medical officer at Providence Medical Group. He says that's because the number of primary doctors available is decreasing.
We are actively recruiting for more primary care doctors. It is a challenge really across the nation right now.
What he's seeing is not a new problem.
We've been talking about this in healthcare for 2 decades now, that there's a looming shortage of primary care physicians.
ROCKWOOD Clinic CEO Dr. Michael PATMAS says the issue has compounded because of the Affordable Care Act.
Washington has had the greatest expansion of Medicaid of any of the states. We have really expanded Medicaid coverage, and it has resulted in hundreds of thousands of people having coverage now who didn't have it before.
He says it's great people now have coverage, but the demand is overwhelming the supply. Frustrating for patients, but they're finding solutions. Short-term problems, they suggest you go to urgent care. They're making it easier for those centers to share information with primary doctors. Providence and Rockwood primary physicians are also now working in teams to manage that added workload.
Something that might be appropriate for an RN to manage and make sure that this patient gets these, their pneumonia vaccine and their colonoscopy and all of that stuff. Maybe that's not all needing to be driven by the physician, that other skilled people can do that work.
Providers say they are working to patch up a much bigger problem, but assure they will get you seen by a doctor. It just might take some time. Now, a fix to the long-term problem. Washington State University says more medical schools within the state. Right now, there is just one that serves the entire Northwest. That's why WSU is pushing for a medical school right here in Spokane. Reporting live from the Sky Deck tonight, John Hendricks, KXLY4 News.